We want to cover as much of the, the people in the front line as possible. Um, with 20,000 doses means that we'll be able to immunize 10,000 people. So that's what we'll be using it for. So I think the Ministry of Social Services, they have a very comprehensive database. It's based on that database that pensions are being paid. And so they cover quite a lot of people. And we're going to be using that. We're also going to be taking the vaccines into the homes of the elderly. So wherever those homes exist, we are going to go there as well. They're kind of captive audience, so we'll be able to complete them very quickly. Right now, it's we have pegged it at 60 years and above. But once we get enough vaccines, we're going to lower that age range. So our intention, we are starting at 60 and above, but we can lower that as we get more vaccines coming in. The vaccines are going to be rolled out in different stages. First stage is health workers, all categories. Second stage, people who are older, so 60 years and above. Third stage, people with some form of underlying illness, so whether things like diabetes, hypertension, and so forth, and that might be even younger people. So if you are 40 and you have hypertension or diabetes, then you become eligible. So that does not have an age cutoff. The criteria there is that you are at risk because of the underlying illness.
Okay.
So we'll be able to do a lot of other people in that category. And after we have completed that, then we're going to go to other persons in the population.
Okay, Minister, thank you for that. Now we have a question we actually have two questions from the Guyana Times. They're asking if Guyana will be donating any vaccine it receives to any fellow Caribbean nation.
We haven't ruled that out, and it depends if, any one of those countries probably have a need. So we haven't ruled that out. So something that we can look at later on.
Okay. And their next question is, as persons who are often interacting with the public, will the first family and members of the cabinet be among the first to take this set of vaccines?
At some point, and His Excellency the President would decide when the government, the cabinet, would take the vaccine. But our priority as of now is to ensure that those categories that I've mentioned, that they get the vaccine.